Hmm? Wala na siyang share, no? Once again, good afternoon everyone. Today we are going to broadcast live stream via our YouTube channel. But the link was already posted in our Facebook page for my batchmates. Batch 2, PCCP Batch 2, Kalig-on. You may watch this if you want. I'm trying to share this procedure because it must be available for all clinic for general practice, because it's a very helpful procedure to help save our patient, no? Because nutrition is one of the neglected aspect in veterinary medicine. Nutrition via enteral feeding or tube feeding is very important, especially for patients that are in critical care or sick patient. As we all know, loss of appetite is one of the most common presenting complaint or symptoms seen in patients, dogs and cats, or even in patients with some signs of malnutrition or undernutrition. Also for patients after surgery, or for those post-surgical patients that needs nutritional support, and patients that have lesions in the mouth that hinder them from eating, So I think nutritional support via tube feeding is a crucial procedure that must be employed in every practice, local practice, veterinary clinic. So today we have a 3-year-old. This is a cat, domestic short-hair cat, presented last week, a week ago, with a constipation, and we did the X-ray before, and we sent some fecal material or herbals. And today, a week after, we're going to perform a esophagostomy tube and manual extraction later, manual extraction of the fecal material that is obstructing the colon or the rectum. And then, based also on the radiograph, there is a distended bladder. It might be due to the presence of fecal material causing compression on the bladder, and also causing straining in urination, not only in defecation. So factors that might cause this problem is not known as of now. Maybe a behavior, patient, environment, or lack of water intake. But as per owner, the patient is already provided with diet, canned food for a long time, and I don't know what's the. And another thing that should be considered is too much grooming of the patient. This patient is is a common observation in cats. Nag-self-groom sila, so the hair might be ingested, cause hair balls. Okay, so we'll go back to our patient now, ready for prep. Once na-start tayo doon, okay, dito na to, kasi dito ka magpapasok na rin, diba, mamaya. So shift ko yung aking again. There is 2 or 3, I think 3 common method in enteral nutrition, enteral feeding. One is what we called nasoesophageal tube feeding. Advantage with nasoesophageal is that it's quick and easy doesn't require anesthesia, a good method of feeding or enteral feeding for very weak animal that will not be good or safe for anesthesia. Second is gastrostomy tube feeding. There are two methods of gastrostomy tube feeding. One is blind percutaneous. I did that many times several years ago. Blind percutaneous tube feeding, gastrostomy tube feeding. And there's another one of gastrostomy method, tube placement. What do you call this? What is the other method of gastrostomy tube feeding? Gamitan ng blind is without ano, yung may camera.
Coloscopy?
No. Endoscopy. Endoscopic guided. Yeah, endoscopic guided gastrostomy tube placement. We never did that because we don't have endoscope. So, advantage with gastrostomy is we can use larger tube for long-term nutritional support. The tube can stay there for months. But disadvantages, again, it uses anesthesia. We need anesthesia and the rest of infection or peritonitis once there is leakage from the gastric content. But the complication is normally associated with the surgeon's error, not with the patient. Another method for enteral feeding is this. We call this gastrostomy. Esophagostomy tube. In appropriate size, esophagostomy tube will be placed percutaneously on this side of the neck, just ventral to the jugular vein. Okay? Dapat medyo stretch yung ano niya. Doon. Medyo stretch yung niya. Yung kanyang, we need to reposition the neck or okay. Apa? Yes. Okay. YouTube na ba to? Nor? Check mo nga. Di ba? The reason why we don't use anymore live streaming procedure, surgery or minor surgery or major surgery over Facebook, that I was blocked several times by Facebook due to the yan. So my position would be here on this side, feeding yan. So I have to change my gloves with sterile gloves. Wala tayong dito ano? Doon, tapos yung gloves. Wala ka na ilagay dito? Wala na? Wala ka na ganun? Ha? Hindi nga. Dapat meron. Kahit ganito na lang, mas exterior ba? Doon, ba? Para mamas doon. Doon. Pwede dito lang, mark. So, I need an assistant that will introduce the, okay. Just want to, to clarify this. This is not for general viewers, This is only for veterinarians and future veterinarian students who want to perform this procedure, because as I mentioned, esophagostomy tube placement is the most reliable method of enteral feeding compared to nasopharyngeal tube placement, because nasopharyngeal is only for short term, 3 days or a week. Due to discomfort, most patient doesn't tolerate nasoesophageal tube. And another pro or cons of nasoesophageal is that due to smaller diameter of the tube, you can only use liquid diet, and that can also be a cause of aspiration pneumonia when the tube is not checked prior to feeding or prior to medications, especially fluids, because sometimes the tip of the tube may be aspirated, go out and may enter the airway. But with esophagostomy tube, we are sure that the tube is in place through the esophagus, and chances of getting into the airways possible. So, here's the stainless tube. Will be introduced into the esophagus, okay, and in this area we will make an incision about 1 cm with a surgical blade. Then we will insert the 9FR, this one. So as you can see, the diameter of the tube is larger. It cannot be placed on the nasal cavity, in this patient, because it's larger. So the advantage with larger tube is that we can give not only liquid diet, some medications, even blenderized food. We can and prevent from being clogged. With proper maintenance lang, kailangan lang ng proper maintenance ng tube to prevent being clogged or mabara siya. So, this one, we'll be using this one. It's short and it's good for cats. Okay. Alam mo na tulon, ha? So, ito yung, magkatapat siya. Okay. So, I need an assistant here for the placement, because one will insert the tube into the esophagus, and the stainless tube will serve as a guide for the silicone tube and for my incision. Okay. Yun na. Normally, ito. Ayan. Blade number 15. Na doon? Tulis? 15. Okay. So, anong coverage ng ito lang? Ito lang talaga. Okay. I-introduce. Sige. Medyo i-extend mo yung neck ng konti. Now, medyo zoom out mo. Alam mo zoom out? Zoom out. Zoom out. Oops. Tama. Yan. Tama lang makita ito. Okay. Naman yung zoom in mo. Okay, the stainless tube will be introduced with the tip directed towards the esophagus. Okay. Yung esophagus niya, andun siya sa may floor ng soft palate. Yan. Okay. Oops. Lumagpas ka na ulit. Dito lang tayo. Okay. Huwag muna. Ibaba muna konti. Ayan. Ayan. Looks dehydrated siya, no? No? This patient is lightly dehydrated. So, one of the reason of constipation, dehydration. So, hindi siya umiinom siguro, no? So, ito yung ating jugular vein. That's the landmark. Should be avoided, no? Medyo. Yan. Ito doon. Dito, diba? Yes. Yan. Ito. Jugular vein, dorsally, and here, move po natin ulit. Move konti. Yup, yan. Okay, yan. Okay, maintain. Sito muna. Okay. Okay, again. This is jugular vein here. Here's the tip of the stainless tube. No, I have now the landmark. Medyo angat daw lang dito. Dito. Medyo abante tala. Konti. Yan na. Maintain na. Medyo dapat nakaano siya. Konti ka na. Need to reposition the patient. Positioning is important. Medyo naka-ventral siya. Ventral. Okay. Oblique. Yan. Hindi yung talagang lateral. Yan. Atras konti. Jugular vein again. Here. Yan. Here. Yes. Yan. Okay. Maintain. So, find the thinnest part of the... Here's my 5. Maintain all on. Maintain lang ulit, ha? Sometimes we cut bezels. Okay. Parang i-advance ka na ito. Konti lang. Yan. Yan din mahigilap. Parang masyado yata tayo nasa doon. So, there is bleeder here. Wait, press. There's bleeding. It hit the bezel here, but that's not, Okay, that's my tube. Hindi lang ha, wait lang. Sige. Dito lang muna, huwag mo na ikotin. Saka mo na siya ikot. Yes. Okay. Sometimes there's blood, sometimes there's no blood. Depends on the location, but the approximate location is just below the. Okay, give me the the 2O cutting needle. 2O non-absorbable. What's the ano bang haba nito? 9 inches. Can you give me hold on. Yung tip measure dyan ng So it's a silicone tube, 14 FR, 9 inches, esophagostomy tube. So it's 9 inches. So from here, 9 inches. So it's 7, 3. So 3 from here, 4. Nandito siya. So it's exact location lang siya. Nandito siya sa may elbow, the level of the elbow. Okay. Wala. Nakakatal na. Hindi ulang nakas. Naglabas ka ta. Nang-asis siya. Okay. So, no need to suture the wound, no? It will heal by stoma. Need this to so this is a nylon 2O cutting suture, cutting needle. Zoom out mga, zoom out. So here's a technique for securing the tube into the skin. Doon mismo sa zoom out. Okay? So what I did is do not tighten that nut, then oops. Not tighten the nut, the skin, because it can cut across the skin in over tightening. Okay. 1, 2. So Chinese finger trap. Last one. Sabi ng owner, kumakain naman to si Coco, no? Pero the main reason why we need to place an esophagostomy tube is to provide the continuous drip with PG 3350. PG 3350 is for Tingnan naman siya, oh. Okay, that's the tube. Okay, now we will bandage the tube. No? Put some dressing here with antiseptic solution or cream. Yung maliit lang, yung maliit lang na 4x4 dyan. May na kayo, Leonor. Masyado kang napopokus dyan. Ito na lang, stethoscope mo na lang. Ano masyado sa tilay kaysa. Then, with a betadine cream. Yep. Okay. Now, next step is to protect the tube and the wound with a layer of bandages. Dito ka, GR, pila. Alalay mo na ito. Para ilalabas natin ito. No? Masyado nakikink. No? Kikita nyo? Kikink. Tanggal mo yan. Tanggal dyan. Alalay lang. Kasi ito kasi naman, dapat tinaganon nyo ito. Daming reason para. And then, yeah, dito. Oh, nakikink siya, nakikink. Ibig sabihin ng kikink, napiplex to. So, pag nagplex yan, hindi na siya makaka-breath. Wala siyang air. Okay? Where is the bandage? So the next layer is this. I need to place some layer of soap, cotton wadding sheet. Very small area. Hindi na pa siya para kasi ni. Scissor. Scissor. Kailangan Tagalog lang. Nakita ito. Tayo na. Oh. This is just an added protection. Avoid makat yung tube. Yes. Then, conforming. Hindi ako bantis ito conforming na to. Isang conforming to. Maganda. Kasi nga dito, ano siya, mainit. So now the layer of bandage, this is the conforming bandage. Yeah. Sure. Okay. Then cohesive. So favorite niyan red. So this is bongbong, no? Red. Okay, slight pressure with conforming bandage. So yung last natin, bandage natin. Yan. Avoid lang na higpitan kasi ang conforming bandage, ang cohesive kasi ano siya, it can cause pressure or pressure ano. Okay, balik nyo muna. Balik muna. Yan. Just ilagay mo dito. Yan. Okay. That's all. We can start giving food in the next 24 hours. So, no food muna. Withhold the food.
For 24 hours.
Hinga ko ng warm water. Mamaya na.
Yung ano.
Pwede natin i-radiograph yun. Ito mga radiograph natin. Para makita lang natin placement nito. If you're not, if you're not confident with the tube placement, especially with nasopharyngeal, you can check or confirm your placement with rods, X-ray. Makikita mo naman, may mga tube na opaque. So, ano pa? Ano pang gagawin natin?
Radiograph.
Ha? Radiograph na natin. Ha?
To confirm.
Mamaya natin, putulin nila natin yan mamaya. Okay? Take a radiograph to confirm our placement. Okay? That's all. I think we can, stop the live streaming kasi ang importante nakita nila yung na-share natin yung placement ng tube, the whole procedure, Yung tube, placement ng tube. What is important is yung landmark, this is the jugular vein.
He have tattoo.
Oh, may tattoo siya. Then, I think esophagostomy tube placement or esophagostomy tube is a very important method or procedure na pwedeng gawin sa every general practice kasi it helps the patient in terms of faster recovery, preventing further weight loss, malnutrition, and immune suppression due to deficiency of critical nutrients, di ba? In cats, especially cats are carnivores, true carnivores, and they don't survive without food in more than a week, maybe. Kasi 20% of body loss is critical. So, kailangan nila ng nutritional support. And another thing is, mahirap silang pakainin at painumin ng gamot. So with the tube feeding, or with the supposed to, magagamit natin to not only for nutrition but also for medicines and other ano supplements,
Laxative.
laxatives. Yan pala ang purpose natin ngayon, no? Mabigyan natin siya ng continuous na laxative. Okay, that's all, and thank you for watching. Finish na. Wala na, paano to?